What I hope to do in the next 45 minutes is to try and take you through the latest research in TCM Oncology. And when Yair developed the day with the ICCM team, we were trying to look not only on acupuncture, which of course has the most amount of information, but also other things with other techniques within our toolbox, like herbal medicine, of course, nutrition, Qi-Gong and Tai Chi, and Twin-9 Shiatsu as well. So all of these things are things that I've tried to dig in the last month to find out interesting research that would be useful for you as therapists, and I'll take you through some of them. Of course, when you look at research in TCM Oncology, the majority of the research that is being done is as supportive or palliative care and not as a first-line therapy. There is some research related to that more in herbal medicine, and we'll see a few examples of that later. And when you look at research and when you you look at PubMed and other sources, the most research that you find is related, of course, to, as Yair and Andrew mentioned, fatigue and hot flashes, general quality of life of the patients, pain, of course, insomnia, and many of the other ones. They're not in sizes sometimes you can generate with word clouds, but there's quite a lot of research, and people research very specific topics. And what I'll take you here now is through the different techniques in TCM that I've shown you, but also giving examples from different types of cancers as well. In terms of the publications, on the number of research and publications that are being published nowadays, you can see this is an article that was published a month ago that looks actually on publications in acupuncture in the last 20 years, from 1995, when I was heavily into cancer research, but basic cancer research, and up to 2014. And you can see first of all, the amount of research that is being published, which is crossing the 1,000 line per year. But more than anything, you can also see the number of publications that are being published every year that has an impact factor, which is some sort of indication on the quality of the research that is being published. Not necessarily. You have to be very critical of the research that you read, but it is some sort of indication on how good the research is. In addition, when they've looked at the topics that were researched, of course, the number one is pain, and that can include pain related to cancer. But when you look at the number two topic, we're talking about neoplasms here, and specifically about breast neoplasms here. So this is the number two topic in terms of the number of publications that come out. Then you have, of course, hot flashes, and you have fatigue, and that can be related to many other diseases. Of course, they've not gone one disease after another, but still it gives you an impression of the amount of publications that come out, and that can be quite useful to us if you know how to read them and evaluate them. In fact, back to what Yair mentioned in his talk, there's a lot of meta-analysis and systematic reviews that come out now on generally on treating cancer, mostly on acupuncture, of course, because the largest number of research. But you can also find systematic reviews on specific indications within cancer, like hot flashes in cancer patients. This is the one that Yair showed. Qi-Gong in cancer care as well. So to reach a level where you've actually been systematically reviewed or meta-analyzed in a way, you have to have a significant amount of research being done in order to be able to have your data analyzed and seeing whether it makes any sense or not. And as Yair shown you, it's not all pink and beautiful. I mean, there is some data that is clear-cut and supports the notion that acupuncture or other parts of other schools of Chinese medicine can help in cancer treatment. And there are others where we need, of course, more evidence, more robust evidence to claim that we can really be part of the treatment tool. And of course, there's already some, and this is a publication from 2016, there are already some publications that actually created an algorithm where acupuncture is being introduced. Now, of course, since acupuncture is being used as palliative care, it cannot be first line because it is not competing with the actual drugs, as chemotherapy or radiation or whatever, but you can see that it is actually being claimed within the algorithm for, in this case, pancreatic cancer pain management, and that's quite nice to see that it's up on the list with all the other treatments.